recording, maybe tonight.
Okay.
Okay, so Kunal, nice to meet you. I am
Nice to
the dean for University of Colorado Dental School, and we're gonna sit together and talk for about half an hour. Just wanted to get to know you more.
Yep, that
So
would
why
be
don't you
great.
tell me more about yourself?
So, my name is Kunal. I am from India. I was born and brought up there in the western part of India in a state called Gujarat. And I grew up and did my schooling all throughout in the same place. After my high school, I went to the southern part of India in a place called Mangalore to pursue my dentistry. So that was something that I did that was out of my comfort zone, leaving my parents and going somewhere else to study. But I'm glad I took that step, and it has made me a better person that I am today. And I completed my 5 years of dentistry, and then went ahead to join a practice as an associate dentist. Worked there for 2 years. uh, After that, worked at another place for half a year, for 6 months, and then decided to come here to give the national boards. And I've been giving exams, preparing for exams, and I've cleared those exams, and now here I am applying to dentist school and aiming to pursue and get into a DDS program.
Okay, great. So do you wanna do like interview, question, and then evaluation, or do you wanna just go straight all the questions and then do a session of evaluation? What do you prefer?
I would say a question and then evaluation.
Okay, so two things that I noticed right away is that you're not smiling at all. That I know that you're a very friendly person. You would otherwise smile a lot, but if you're not smiling, it shows two things. Either you're not friendly, which they don't like because they want to invite someone who is friendly, and the other thing is either you're nervous and you're not going to be able to handle the uh, dentistry work in that
Right.
school. So you have to smile a lot more. Make sure you're
Okay.
recording yourself on camera, and you're gonna see it tonight. You'll see that when you're smiling, the interviewer is also gonna smile along with you. Just it puts them at ease. Make sure that they have a good understanding of you as a person.
Okay.
And the second thing I noticed right away was that you're moving your eye contact all over the place. This is face to face, but over Skype, so it's much difficult. But you're gonna be in person with them, so make sure your eye contact is you're contacting your eye with their eye level. You're matching their eye. Not in a creepy way, but make sure that at least when you're talking to them, giving them an answer, looking at their eye directly.
Right.
I know in like I'm from Bangladesh, and other people in India, Bangladesh, we try to respect people that are older, and we don't really talk to them, eye to eye. But in the U.S., it's like a friendly gesture that you talk to someone with, eye to eye, and it if you don't do that, it looks bad on you.
Right.
Two things on that. Now about the content of what you said, what do you think? How do you feel about what you said?
I feel like I can say a lot more, and
Okay,
I can include a lot more, but then I don't, because at the same time I don't want to make it a lot lengthy and boring for them. I just want to keep
right,
it short.
right. Um, you definitely want to bring up personal aspect of your life. It's important because you're going to school. You're not going to a job place. You're not. This is not like a job interview where you are like telling what your strengths are, weaknesses are, right then and there. So more personal stuff is gonna help you out, but you have to limit what you're saying. The way that you said it, it's kind of like almost put me to sleep. No, like don't get it wrong. Almost
Yeah,
put me to sleep, and they don't like that.
okay.
What you need to do is basically tell them where you went to high school, and then that you moved from I think you're from Gujarat, and you moved from Gujarat to Bangalore, and
Yeah.
why that shift was important. When you're talking about Gujarat to Bangalore, you're like your face lit up. You said that was the first time I moved out of my house, and I had to live without my parents, and it was hard. So I had to go outside of my comfort zone. That's something people like, that you're going outside of your comfort zone. When you're talking about this part, definitely emphasize. And then you talked about, I worked here, I worked there. Make sure you specify where you worked and what you learned when you worked there, because they don't care. They don't care where you work. There are probably thousands of clinics you could have worked in India. Why you're telling them that you worked there instead of telling them somewhere else? They need to know what you learned when you're working in that space, and how many years that you have worked there, because you're an advanced degree student, so they're considering you based on your experience, right? They want to teach you more so that you could become a better dentist, and you also could practice in the US with a license. So you have to know that they're looking for number one, experience, and you have the experience. You have to tell them what experience you have, what you have done in the practice, right? So why don't you try again? And this time you have 1 minute and 30 seconds, and give me a good answer.
Okay, so my name is Kunal, and I am from India. Now, I was born and brought up in a place called Gujarat in the western part of India, where I did my schooling. I went to a school called Baroda High School and was there for throughout my schooling till high school. After high school, I decided to go to a certain state in India called Mangalore to pursue my dentistry, and I feel that was one of the wisest decisions I've made, because I stepped out of my comfort zone and decided to stay without my parents and just make me a better person that I am today. After pursuing 5 years of dentistry in Mangalore, I came back to Gujarat at my house, and that's when I started working at the place called Disha Dental Care as an associate dentist. Now that's where I learned that the things that we study in book has its application in the real world, and to actually deal with patients. So that was the biggest lesson that I learned when I started working at the Dental Care. My mentor was a great dentist. He taught me so much. He taught me to deal with patients. He not only taught me to work on patients, he taught me to deal with patients. He taught me to be not only a dentist but a friend to them. I worked there for 2 years. After that, I went ahead and worked for 6 months at another place called Dr. Pathak's Dental Clinic. The thing that I learned from Dr. Pathak is how to be compassionate and how to put the patient as the primemost thing when you're dealing with the patient, how to feel what the patient is feeling, both of which I feel has made me a better person and a better dentist. After that, I decided to come here to give the boards. I came here. I stayed at Iowa at my aunt's place, where I gave the NDE Part 1 exam. Then I moved to New Jersey and gave the Part 2 exam, and started the application process. And here I am sitting in front of you, hoping to get into the University of Colorado.
Okay, don't say the last sentence.
Okay.
Don't say the last sentence.
Okay.
Now here I am. Let's stop right there. Don't say your hope, because what you're trying to say, you're like, you're hoping to get in. That means that you're not confident in yourself, right? Mm-hmm. That you, like, if you're confident in yourself, you'll say, this is my dream, to practice in the US, and coming here is a step towards achieving my dream. That's a different way of ending it. It's much better, but it shows that you are confident in what you can do. Much better answer. Do you feel better about this?
Yeah.
Okay.
I do, definitely.
What I recommend you to do, and if you have watched all my videos, it says basically record yourself. Like now, how you're talking to me. Talk to yourself on Skype or on any kind of like video software. Just record yourself. See how you do. Like,
Right.
Try to cut down all the garbage things that you would not say in the interview, and just practice a lot. The first version is gonna be very crappy. Second version is much better, and then as you practice more and more, like 10th version, 20th version of how you say it, it's gonna be way better than how you're talking right now. All right.
Right.
But you definitely saw some improvement within the first version to the second version, where
Definitely. Yeah.
right you're smiling more,
Right.
you're projecting more confidence, which I think all the all the admission committee is going to look at as a more favorable perspective of you. Um, all right. So what are some of your strengths?
Okay. My strengths are that I am a
Wait,
compassionate person.
wait right there.
Okay.
The way you said it, my strength. Like you were surprised. You're not expected to.
Okay.
Like, were you expected to answer this question? No, right?
Uh,
Were you expecting to like see come across that question at all, or no?
yes, I was.
Okay, but the way you presented yourself did not show that, right?
I am actually confused if I should actually show them that I know I was going to be asked this question and actually say that I have make them see that I have rehearsed for the
You
answer.
don't want to show them that you rehearsed. Definitely no, because if you're surprised, that shows that you're not a calm person. Because as a dentist, you have to be calm in very in a lot of situations. You're doing one thing for maybe 2 hours, 3 hours at this, and things can go wrong. You need to stay calm and focused. Now, you like when you talk about your strength, you know you can start with some of my strengths are just very normal, like you're like having a conversation, not like okay, like that shows that you're sure about your strength. So let's try again, okay?
Okay.
What are some of your strengths?
Some of my strengths are that I'm a compassionate person. I am thoughtful of others. I try to put myself in others' place and try to feel what they're feeling. I
Okay.
am a hardworking person and am a determined person.
Okay, it's all good, but you need examples of each. If you give me two strengths, you need two examples for each strength. um, Compassionate is it's pretty straightforward. You can talk about any kind of experience you had in clinic, and then hardworking could be hardworking is difficult to exemplify because it's different in different culture. So you need to make sure when you talk about hardworking, you need to talk about overcoming some adversities. Like, oh, this exam was really challenging in India, and only maybe like 2%, 3% gets through it, and I was able to concentrate on the work material as well as I was doing a lot of other things at the same time. Um, so when the exam came out, I felt unprepared, but I worked really really hard to cover all the materials, and then finally did really well in the exam. Like I just made it up. It's probably really bad, but you need to find out an example that shows that you're hardworking. Not just telling me what you are or you have a strength, but show me what you are, right? So try again.
Okay.
What? Are,
One question.
yeah.
Is that hardworking, compassionate, determined are probably going to be the most common of answers, right? By
Yes.
the students.
Yeah.
Now, what I was thinking was if I can actually go personal and maybe think of some other qualities, strengths, weaknesses.
I think that's a great idea. What do you have in mind?
I can probably will have to think a lot on it. I still don't
That's
know.
good. That's good. That means that you're thoughtful. That definitely shows that you're not just want to be cookie cutter answers. You want to give them something that's good. So think about it. Write it down. See, like take a piece of paper. Write down what are some of your strengths. And like when you're thinking about it, connect your life experiences with this strength. Like maybe what can I talk about when I'm talking about this strength?
Okay.
All right.
Okay.
This is definitely gonna come up. It's about your weaknesses. Tell me about your weaknesses.
About my weakness, I would say that when I am determined to complete a particular project, I put a lot of stress on my body, and that tends to wear my body out and takes a toll on me physically.
Okay.
What I'm doing right now to overcome that is that I learn to take cues from my body that is getting tired, and I learn to stretch, to exercise, to do yoga, and that's how I've overcome my back problem, back
Okay.
pain problem.
Okay. That's a good answer. How can you make it great? It was a good answer. It has a good baseline. Now your idea is to make it from go take it from here up here. No idea. So you have to make subtle tweaks, right? Um, I'm usually a very hardworking person, but when I work really hard, I tend to neglect my body. I don't exercise all the time, or I don't eat well. And when I was a dental student in India, and that really took a toll on me because I had 4 subjects or 5 subjects that I was studying at the same time, and I had finals, and I wouldn't eat dinner all the time because I just didn't have time. I was busy studying, and during one of the exams, I almost fainted because didn't get to eat anything. And after that, I realized that I need to start taking care of my body. So slowly, I started to make sure I have a routine where I eat properly and exercise, and especially do yoga because I really like it at set times so that I don't miss it. Now I'm in a much better place where I can balance my study as well as my exercise routine and eating habits such that I don't have that problem anymore. I've been working towards improving every day. I still have days when I forget to eat or forget to exercise regularly, but I'm much better than what I used to be. Does this sound better?
Yes, yes.
Why does that sound better?
Because you're explaining everything, and you're giving reasons for everything.
And I'm also very slow and painting a picture to them, right?
Yeah.
The hardest thing for you would be now if you need to practice more, would be to paint a picture, tell them how it is, right? They don't know, they haven't been through your life, right? They're only meeting you for 2 hours, 3 hours, full day. It's not enough to get to know you. So you need to give them pictures of your life that illustrates who you are as a person.
Okay. Yeah.
And one thing that you need to remember is that as a science student, as a math student, dental student, you are very logical. You always think of one answer, but there is no one answer in this kind of interviews. There are multiple different answers, and everything is right. There is no wrong answers. The only wrong answer is that if you think it's wrong, that's when it's the wrong answer, right? So if you think that my answers aren't right, that's a mistake. My answers aren't perfect. That's a better way to say it, because I wish I had better opportunities to paint the picture. I wish I had talked more slowly, smiled more, etc. Those kind of things. So I want you to do more exercise of your strengths and weaknesses, and also learn to paint a picture better.
Okay.
Right?
Yeah.
Okay.
Right.
So tell me about a situation when you had to face an ethical dilemma.
Um, I was at Disha Dental Care, my first job in Baroda, my native place, and I treated an old man. He was in his 50s. I treated him for root canal, and when after the treatment was over, when it was time for him to pay for the treatment, he told me that he had dental insurance, and dental insurance is not a very common thing in India. So he hadn't mentioned it beforehand, and when he said that, I said okay, and I gave him a total, and he gave me the money. But when I had to write out a claims form for him, he asked me to put in a bigger amount than he had actually paid me, so that he could put in a bigger claim and claim more money than what he had actually paid me. So that was something that I wasn't ready to do, and I told him politely that I wouldn't be able to do that, and I would put in whatever amount of money he had given me as the claim amount for his insurance purpose.
That's a great answer. Do you think anything needs to be improved? in that answer? I thought it was great. You painted the picture very well. You had a scenario that you weren't comfortable with some kind of scenario, ethical scenario, and then you decided to do the right thing, not the wrong thing, right?
Okay.
So
That's
I think it's good enough. I don't know. You shouldn't be worried about it.
okay. This is actually that something that has happened with me. So
Right. I think that's why you are answering it better because you had experienced it in your life. Interviews are just about experiencing different things in your life and talking about those experiences. It's not just memorizing things and explaining it in the interview. So I think what you need basically right now, you need a lot of practice, do a lot of video, and try to smile more. Like talk to others when you're talking to others. Maybe you're gonna go outside and get a coffee or something. When you're talking to the person that's serving coffee, smile to them. Talk to them in a nice way. That kind of will help you later down the line to smile to a stranger because you probably don't know who these deans are, admission committee people are. So you're gonna have to be very comfortable around them right away.
right.
And if you can't, you're missing the opportunity to get admitted. So make sure you smile a lot, not too much. A lot of girls in the US, they giggle a lot, and that comes across as unprofessional. So you have to keep it within the professional limit. Smile, but not too much. But if you don't smile at all, that comes across as either nervous or unfriendliness. So you're good to go. Any question?
There's a question in one of the lists that I was going through.
Mm-hmm.
What has changed in dentistry over the last 25 years? And I'm not at all sure what the answer to that is.
Okay, so that's a current trend that you need to read about. So that question usually doesn't come up for undergrad interviews, but it comes across for your interview because you're more experienced. So you need to be able to tell, at least what trend you have seen in India that has been changing because you are more familiar with that industry. In the U.S., you can politely say that I'm not much familiar with the trends in the U.S. because I haven't practiced in the country. But from where I practice in India, a lot of people used to not be aware of dental treatments, but now they're more aware of it, right? Those kind of things fluoride treatments aren't much common, but now everyone is asking for it. Something like that will make you sound like you know what you're talking about.
Okay.
Yeah, but if you wanna go advanced, you have to do some research, understand some of the trends that happen in the U.S. I can't tell you right now because I don't have research in front of me. But some quick research in Google will definitely give you some answer.
Okay, sure. Thank you. Just last question.
Take your time, yeah.
One of the questions is, what makes you think that you will be a good dentist? Now, the answer for that is similar to why do you want to be a dentist?
Similar to that, yeah. But I would say it's more of a hybrid question that shows what are some of your strengths and what are some of your like why dentistry. So you have to combine them, right? So you can say from a very quite early age, I have been passionate about dentistry because I've seen one of my uncle died because of oral cancer, and that pushed me towards dentistry. And when I grew up, I attended dental college in India, and when I was attending college, I did some preclinical studies and clinical studies where I had interacted with patients, and working with patients really made me feel, really made me feel that I'm good with my hands, and I'm also very good with people interaction. Two of the most important things necessary to become a good dentist. Along with that, on top of those two qualities, I feel that I'm very compassionate. Whenever a person comes with their tooth pain or any sort of pain, I'm able to understand their pain and able to interact with them in certain way that puts them at ease and makes them comfortable being in the dental chair and getting treated by me. So I think because of those qualities, I would be a good dentist. Did I convince you that I would be a good dentist?
Yes.
Okay.
Yes, you did. Yeah.
Okay.
Those were actually the reasons that I was thinking in my head, and that's the reason I was actually happy to hear the answer that you put it.
Again, there is no right or wrong answer. There is
Yeah.
yeah, but a good answer has to encompass a lot of things that I talked about: compassion, being good at people, being good with your hands, and then that have some interest about dentistry.
Right, okay. When they asked about why you wanted to come to the US to pursue dentistry, now my actual reason is that when I was working as a dentist for the 2-year job that I had,
Okay.
I actually had a chance to look at patients that had treatment done here, that had dental work done on them here in the US, and they were visiting India and they were getting some other treatment done there. And when I saw the work done in their mouth, it was beyond excellent. I saw some onlays, I saw an amalgam restoration, I even saw a crown, and they were as they were described in the book which taught us. So there was perfection in the work, and that's what I wanted myself to learn.
Okay.
That's what I wanted to achieve, and that's what made me decide to come to the US to pursue dentistry.
That's a good answer. You can do better. You can definitely talk about, when I came across patient that had done work in the U.S. I had seen experiences XYZ that you talked about, and then on top of that, I realized that there are still a lot of knowledge gaps that I could fulfill by coming to the U.S. Um, in India, there aren't much opportunities that I would get in the U.S. For example, being able to learn a lot more, do research that in India is not it's not very common. So those kind of things you need to bring up, like things that you couldn't get in India, such as being able to do research. Right? I don't know how much time you have for research, but I'm sure Colorado is a good school for research. Um, they sell they sell their own school on that. Other things that you couldn't get in India, put yourself in the shoes of like a dentist that's in India right now, and what are some of the things that don't get? Good instruments, right? Right, like that thing, like always puts dentist at kind of discomfort, because you have to have the right instrument, you have to have the latest technology that you can get, right? So those are the things that you need to know about: latest technology, latest research, being on the cutting edge of the industry. That's why I want to pursue my dental degree in the US. Right? Those have to be mentioned in your answer.
Okay. Okay. Yeah. Yeah. Because in my head, it all seems like everyone's gonna say this. That's why the confusion is.
Right. Um, Everyone is going to say that. That's not, that doesn't make you wrong when you say it. Cliche answers are cliche because people have to have a justification for why they're pursuing dental degree in the U.S. For a lot of people, it's the dream. Coming to the U.S. it's my dream come true. For some people, it's being on the leading edge of the industry. Be the best dentist I could be. I couldn't have become the best dentist in India, and that's why I'm pursuing my dentistry in the U.S. And that's no, there is nothing wrong with that. Do you feel like there's something wrong with that? No, there's nothing wrong with it, right?
There's nothing wrong with that, but it sort of feels in my head that I'm putting my country down, my profession
No,
down.
no, no, no. You're not doing that. You're like, what you're doing is that if you're not answering in such a way, you're saying that why would I do something that's better than what I have in my country. What you can say is that I want to achieve that dental education, and then eventually I want to go back to India and serve people that don't have the necessary background, or that don't have the access to dentistry. So that's one of my dream, that getting this education would help me get there faster. So those kind of things, you can always put some positive spin on what you're saying, right? A lot of people are going to say, oh, better education, better research, cutting edge technology. Add something on top of that, add humanity on top of it. I'm going to go back to India at some point in my life, help people that don't have dental access. Does that make your answer better? Of course, yeah.
Yes, it does. Yeah, definitely.
Yeah.
Yeah, yeah, yeah. Yeah. I think I've covered most of it. I'm gonna practice more. I definitely need to practice
Right.
more.
I don't know how many interviews you're going to get. Maybe two. One with the student, perhaps. One with the faculty. Could be.
It's all it's a combined. There's staff and students together. Therefore, there's going to be 2 staff or 3 staff and 1 student or 2 students, so 4 people in together. All
Okay.
together.
So you know how the format is going to look like.
Yeah,
Okay.
Yeah.
Make sure you're confident, smiling, um, and then you're not um, like nervous or anything. If you're nervous, the thing that I do usually, like before, if you're really nervous in front of the interviewers, what really helps me is to go to the restroom sometimes and just like take 10 or 15 deep breath, and it really puts me at ease. Because if you're nervous, if it comes across to them, they will be reluctant to take you, right? So don't show that you are nervous or anything. But you did great. You have you need some more practice, and after that, I think you'll be good to go.
Okay. Okay. Uh, just one more question that I asked you before, that when a friend is cheating on an exam, what will you do? I still um,
You tell the proctor. That's the right thing to do.
yeah, that's the right thing to do. So
Yeah,
yeah.
you just make you just paint it in such a way. He is my friend from 10 years. Since I was 10, and I didn't want to ruin his future. But I thought that I would do a disservice to him by not telling the proctor about it, because um, if he does this, if he thinks that this is a small mistake he's doing in his life to get where he wants to go, he'll make bigger mistakes, and I want him to not make those bigger mistakes.
Right.
Yeah, you're gonna have to project future, how how future could look very bleak for him. Maybe it's a temporary suspension he's gonna get from this school. But what if he is accused of a bigger scandal, bigger corruption scandal in later in his life, and goes to jail for 10 years? I'm actually doing him a service than a disservice.
Okay. Yeah. Right. When I enter the room, when there's like a panel of people sitting there, do they actually shake? Do I actually shake hands with each one of them?
Yeah, you should make an effort to. Yeah,
Okay.
and if it's 4 people, you should distribute your attention and eye concentration with each person. Don't try to just talk to the dean. Looking at the dean, it makes it look bad on you, because you wanna give attention to everyone who is in the room equally.
Okay. Okay. Yeah. And one more question, just last question. I know I'm taking a lot of
Yeah,
your
it's
time.
fine. We can talk until 3.
Okay.
Um,
When they are going to ask me about my leadership skills, I want to tell them about being on the council, the student council in my dental school in India.
okay.
So, I when we are in the student council in the third year, we make up the student council. It's the students who elect the president and the vice president. And when I was on that council, we organize all the events for the college. We organize student activities, student staff activities, staff appreciation activities, and all. We have a cultural week at our school, so we organize all. The whole cultural week. We have traditional day, we have a Western day, Eastern day, and stuff like that. So we organize all of that. Now, I know there's a question that's going to come up, is that how, tell me about an incident that show your leadership skills. Uh,
Yeah. In the in in this sort of interviews, it is less common. If you went to school in the U.S., they would ask you about that more. Leadership activity is definitely something that dental school look into asking. But for you, I think more focus would be on your experiences in dentistry, because you are an advanced degree student. But definitely, if you want to talk about your leadership skill, you have done 500 things within your club. They don't want to know a laundry list of things that you did. What they want to know is that what are some of the achievements that you want to highlight. So, for example, being on the student council, put me at a position to make decision for the whole school. We would be making decisions about the leaders that comes out of the school and become the president of the student body. So we had, in order to get that done, we had to organize XYZ events to make sure that everyone is aware of who are the candidates and what they can do about the school. So I was responsible for XYZ in that role. I I managed like 5 people. I don't know. I'm just making it up. I managed 5 people, and then distributed leaflets to students to raise awareness about the potential candidates. And also on the side we ran for oral cancer walk. We ran for oral cancer day, or we did like free. In dental school, we did some free activities for people that didn't have access to dental care. So those kind of things you can add on top of your answer when they ask about leadership activities. But it's not going to be the sole focus of, it's not going to break or make you. If you don't have leadership skill, that's what you're trying to go to school in the US, to earn that leadership skill, right?
Yeah. Right.
And you have, like, if that's the case, if you didn't become the president of your student council, or if you didn't do like the most like, what do you call it, like the most significant leadership activity in your country, it's not, it's because that you probably didn't have the opportunity, or you probably didn't have the time, and they understand that. So what you have to spin it, like, you have to say that this is why I'm coming to the US. One of the reasons that I realized I needed to come to the US was become a leader within my profession. And I know that this school is going to give me that opportunity to become the leader that I want to be within my field. So you can always put a spin towards the answer that you're going to give them, about the field, about your field, and about the school that you're going to. On top of that, do you know why you want to go to University of Colorado? Do you have a generic idea, like what the school stands for? Why are they better than other programs?
I know they have a state-of-the-art school. The facilities, they have a digital scanner for impressions.
Okay.
They give a lot of importance to research. They ranked 8th in NIDCR funding in 2014. And what I've heard about the school is that it's an excellent school. Everything, the campus, the school itself, the staff is very good.
That's very generic. You gotta be better than this.
Also, that I know it's one of the schools that where the students of the international student program, they get to see patients within the first 3 months of the program.
Okay, that's better. So what you need to do is that do more research. A lot of the things are not online. You can't find a lot of good things online. So what you need to do, if you have time, if you don't have time, I don't recommend it, but you can definitely talk to people that are studying there, that are in this school at the moment. Reach out to them, ask them, what is something good about your school? Like, why should I go there? People are usually helpful. They want to help you out. They'll tell you, because of XYZ, we are better. If you think about it, a few things that, when I was looking into the research school, I was really struck by the research opportunities that University of Colorado has. I haven't seen a similar type of research happening at other dental schools in the country. But on top of that, I found that the advanced degree students get to see patients within 3 months. In other school, it could be much longer time. So as a dentist who practices abroad, I want to get place. Well, I would say I want to get placement within a clinical setting as soon as possible, that I can't get in other school, right? So those are the 2 reasons, and you need to have a third reason. And finally, the people I met at U Colorado, the faculty, staff, and the students I met today, they're amazing people. I have had great conversation with them about dentistry and how it's how it's being shaped and challenged within the next few years. And for those few reasons, I think U Colorado is a better school for me than any other school. That's even then, I would rate my answer as a C, because I don't know anything about the school. You need to get more details about the school, understand why they're different. Like when I interviewed at Penn, we talked about the electronic medical record system for dentistry, That was the year they became completely paperless, and that was a big deal. And then their externship program was pretty good because they would allow some of the students to go abroad to countries like some countries in Africa and some countries in Latin America, so that you could get exposure to patients in different countries. And those are specific things that, let's say, you wouldn't find in typical website. You had to dig deeper. The other thing that I did was, if you have Google News is pretty good. You search for University of Colorado Dental School, and then they give you a list of news that happened within the last year or two, and you can see what news is pretty interesting.
Okay.
Yeah.
Okay, I'll do that. I also have a friend whose friend is at University of Colorado.
Okay.
She's the person who told me that you get to see patients within the first 3 months of start of the program. But they are a little reluctant on giving more information. I don't know why, but
Okay.
it's
Yeah, just talk to more people if they're reluctant. So, and then find out what makes this school really special, because that's what they're gonna ask you. Like, why do you wanna come here? Because you have been to you said we went to Iowa and then New Jersey. So they're gonna ask you. There is Rutgers next to you. Like, why not Rutgers, or why not NYU? Why are you trying to come here? Right.
I should actually compare.
No, don't compare. Don't compare schools to schools. They're gonna ask you. It's like they're playing devil's advocate. They're gonna ask you why, like why this school, and that's gonna be asked multiple times if you have multiple interviews. So make sure you have a good answer for that.
Yeah,
All right.
look for more for a better answer. Yeah. Okay.
All right.
Thank you so much for your time. Thank you so much for your guidance and everything. Thank you.
Yeah, no problem. And yeah, I'm not a doctor, but
Yeah.
I I try to help as much as I can.
Yeah, because in one of the emails you sent me, I read that you had interview at UMDNJ, you had interview at UCSF, UCLA. Yeah.
UCSF, UPenn. Yeah, I got into all the schools that I interviewed.
Yeah. So that's the reason. I'm sorry. I didn't.
And then I decided not to attend dental school.
Okay.
Yeah, but that's a long story. Anyways, let me know how it went.
Sure.
Shoot me an email or something, and if you have any question before the interview, let me know.
Okay. Sure. Sure. Thank you so much.
All right, take care.
You too. Thank you.
All right,
Bye.
bye bye.
Have a good